All right. Well, hello. Happy New Year, everyone. Happy Friday. Hope everybody's doing well. All right. So it's been a while since I've gone on Facebook and YouTube. I hope I'm live on YouTube. I assume on Facebook using StreamYard with Facebook. StreamYard is this platform, and usually it's pretty easy with Facebook. With YouTube, let me just make sure it's yeah, hopefully it's live on YouTube. I'm trying to figure out how to see if I'm live on YouTube. All right. Yeah, it looks I think I am live. If you're watching this live on YouTube, let me know. Let me try one other thing here. And if there are questions, let me know. I'm gonna just go over a few things before. And yeah, looks like I'm live. Let me just bring this up here. Yeah, looks like. Okay, awesome. Okay, thank you. Thanks, Our World 2004, letting me know that I am showing on YouTube. Okay, so let me just for those who are not familiar with me, just want to share some resources. I have a podcast, SaveMyThyroid.com, and or Save My Thyroid, which you could find either by visiting SaveMyThyroid.com and clicking on podcast, or just visiting your favorite podcast platform on Facebook. I'm sorry, on on Apple or Spotify, not on Facebook. So yeah, the podcast a little bit more of a focus on hyperthyroidism, but most of the episodes will benefit those with either hyperthyroidism or Hashimoto's, especially the interviews. When I interview someone, usually it's something that can benefit both. When it's a solo episode, I'd say probably like half the time it's benefiting those with hyperthyroidism, and then half the time it could benefit those with both hyperthyroidism and Hashimoto's. All right, so naturalendocrinesolutions.com, that website was released, hard to believe, but almost 16 years ago, 2010. Has hundreds of articles and blog posts related to hyperthyroidism and Graves, hypothyroidism and Hashimoto's. Also have a supplement line, which you can check out at thyroidsave.com. And then I have a newsletter, so it's not really new anymore. It's been out for almost a year now, Healthy Gut, Healthy Thyroid. And you could check that out by visiting savemythyroid.com/newsletter. And then a few books, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. If you get this, make sure you get the 3rd edition. I have a book, Hashimoto's Triggers. Again, hard to believe that's so. The first book was released in 2011, but the 3rd edition, 2023. Hashimoto's Triggers, 2018. So February of 2018 is when it was released, almost 8 years ago. And then almost 2 years now, the Hyperthyroid Healing Diet was released in spring of 2024. And then YouTube, I have videos on YouTube, savemythyroid.com/YouTube. If you want to take my Save My Thyroid quiz, you can visit savemythyroid.com/quiz. And then I also have, for those with Graves' disease or other types of hyperthyroidism, I have a Healing Graves Naturally school community, which I released a few months ago, launched a few months ago. So far over 800 members. Not making it as big, like the goal is not for it to be as big as my Facebook groups, which are, the hyperthyroid Facebook group has over 25,000 people. So I'm really don't want it to get that big. Right now it's free. I am strongly considering having a small monthly or annual charge to prevent it from getting really big, but right now it's free. And if you want to join, you could visit savemythyroid.com/heal Graves' disease. Okay, and then an announcement. So I will be having, for those at Hashimoto's, there is a summit. I have sent an email out. So if you're on my email list, I don't have the link to that because it's not my summit, it's someone else's summit. But for those with hyperthyroidism, there's a 5-day hyperthyroid healing diet challenge, which is starting on Saturday, January 17th. So a week from tomorrow. Will include 5 daily recorded lessons, 5 calls Saturday through or live calls Saturday through Wednesday, engagement with others, prizes for participation. So the investment is $17 or free if you either have purchased my book, or if not, you could always go ahead and purchase my book, The Hyperthyroid Healing Diet, which is on Amazon. And yeah, to register for the challenge, you can visit savemythyroid.com/challenge 2026. Okay, and once you read, there is an optional VIP upgrade as well. All right, so questions. So if there are questions, you could enter it in the chat for either if you're on YouTube or if you're on Facebook. In the meantime, I'm going to leave this slide up for anyone who trickles in late. All right, so Arwell 2004. I'd love to try that. So I'm not sure if you're referring to the challenge. So yeah, like I said, if it's only $17, but if someone has purchased the book, The Hyperthyroid Healing Diet, then you get free admission to that. Let's see. So this question from Camber 6799: if Graves' disease was caused by iodine overload and not genetics, is it harder to reverse? Not necessarily. I mean, if it's not Graves and iodine, like if it's iodine induced hyperthyroidism that's not related to Graves, then sometimes it could be more challenging to reverse. Like it will, either way, it'll usually take time. When it's Graves, it's usually not exclusively caused by the iodine. Like iodine is more like the straw that broke the camel's back, not it's not like the sole trigger. So obviously the goal is to like take a break from the iodine. Um, I mean, I'm not anti-iodine, but in this case, you want to be careful. I mean, in all cases, you want to be careful about supplementing with iodine separately and really high food sources of iodine. And again, everybody's different when it comes to iodine, but in this case, no. Like genetics, with Graves, you got the triad of autoimmunity, genetic predisposition, exposure to one or more environmental triggers, as well as that increased intestinal permeability, which is the medical term for a leaky gut. So again, there's always going to be a genetic component, but there's usually multiple triggers. There's that leaky gut component. So iodine, in the case of Graves, usually iodine is one factor. So yeah, you definitely want to reduce the iodine, take a break from the iodine, ideally, in this situation. But yeah, I wouldn't say it's harder to reverse. It's always like Graves. It's never easy to reverse. I mean, when I dealt with Graves, I would consider my personal situation not easy, but compared to others, it wasn't as long. Yet it still took about 9 months. So that's on like the shorter side when we talk about these conditions. But yeah, whether it's Graves or Hashimoto's, again, it definitely takes time. So I would never say it's easy. Um, and in this case, I wouldn't necessarily say it's harder when dealing with Graves that was caused by iodine overload. All right. Any other questions? If there, again, that's why I'm popping in here to see if there are questions. And oh wait, actually, looks like I was just hovering over a question. I was kind of blocking it out here. Hopefully, I don't even know if I clicked on this before. So this was, yeah, I think I forgot to click on it. So yeah, let's bring up Susan's question here. So how do I find treatment for symptoms waxing and waning over the past 18 months when carbergoline and methimazole do not help? Labs show suspicious nodules and a high T4, no diagnosis of what is causing the hyperthyroidism. Yeah, well, I mean, you're not going to go as much by the symptoms. I mean, with the symptoms, if if you're fluctuating between hyper and like if someone's consistently hyper, then yeah, you would want to do something like whether it's methimazole or bugleweed, L-carnitine. Um, but again, those are just managing symptoms, and it sounds like they were not really doing much of managing the symptoms. So if I'm assuming you were tested for Graves and that was negative, because if it was positive for Graves, if you had the thyroid stimulating immunoglobulins and or the TSH receptor antibodies, which are more specific for Graves, and if they were negative, then you would want to address the autoimmune component. But in assuming Graves is negative, and if it's the nodules, because I mean, nodules definitely could be a factor with hyperthyroidism, especially since you've had it for a while. Like if it was only a few months, there could be the possibility of subacute thyroiditis. But if we're talking about 18 months, and if you don't have Graves, then I would look into the nodules, like addressing the cause of the nodules, which you could do. Another option, I mean, if it's suspicious, I assume they either recommended biopsy or you got a biopsy. But another option for nodules, especially larger nodules, for someone whatever for whatever reason doesn't want to address the cause of the problem, um, but wants to get rid of the nodule, there's also radiofrequency ablation, which again, some people confuse it radioactive iodine, so I definitely don't recommend radioactive iodine in this situation. But radiofrequency ablation is using radio frequencies to shrink the thyroid nodules. And I had on my podcast, probably now it's been a couple of years, when I had Dr. Angela Mazza, who is a integrative endocrinologist, and so she mentioned, I think the interview I had at the time, that first interview, it wasn't approved for suspicious nodules or cancerous nodules, but I also had a summit, a thyroid summit, and I interviewed her, and she said that now, like, you could use radiofrequency ablation in some cases of cancer as well. So so that's an option, is to look into radiofrequency ablation, and maybe in this situation. Uh, so yeah, because there's only a few different types of hyperthyroidism. There's Graves' disease, which is autoimmune. There's Hashimoto's, which is also autoimmune. There's nodules, like toxic multinodule goiter, or just toxic nodules. And again, in that case, you want to address the nodules. And then there's subacute thyroiditis. And like I said, this doesn't seem like it's that type of situation. Okay, let's go to Barbara here. So Barbara asks, how would you know if you have hyperthyroidism Graves' disease? Is there a specific test? I didn't get a clear answer. How to titrate off methimazole, lots of side effects from methimazole. So, I mean, hyperthyroidism is when you have elevated thyroid hormones. I mean, there's also subclinical hyperthyroidism. And Barbara also said no nodules, told it's inflammation. Um, yeah, so it sounds like maybe it's subacute thyroiditis if you were told it was inflammation and not. I mean, great. So hyperthyroidism, when you have elevated T4, T3, which are the thyroid hormones, and then there's TSH, which is thyroid stimulating hormone. TSH is a pituitary hormone, and with hyperthyroidism, that's low or depressed. So again, what just hyperthyroidism, you have low TSH and elevated T3, T4, and then Graves, you have elevated antibodies, thyroid stimulating immunoglobulins, or TSI, and or TSH receptor antibodies, or TRAB. So if they tested the Graves antibodies and it was negative, and but you had hyperthyroidism, the elevated T4, T3, depressed TSH, then maybe you have subacute thyroiditis. That's what it sounds like if they're saying it's inflammation related. But if those other antibodies were tested and were positive, then we're looking at Graves. And then titrating off methimazole, I mean, I can't tell you like what to do with that, because I don't have prescribing rights. I'm not a medical doctor, so I'm a doctor of chiropractic. So I mean, that's the endocrinologist should do that based on the numbers. As someone's thyroid numbers improve and then maybe even eventually become more a little bit hypo on the hypo side, then they should decrease the dosage of that. Yeah. So and that's what, like, when I'm working with someone and if they're on methimazole, I never say let's reduce the methimazole. I say, let's say if they're on 5 milligrams of methimazole, you might be on a higher dose, but I would say, okay, these numbers are looking better. Why don't you go to the endocrinologist and ask if they could decrease the dosage of methimazole to like from my 5 milligrams to like 2.5 milligrams, and then some people will choose to do that on their own, but I can't say for people to do that. And then let's see, Barbara, yeah, thyroiditis. Are we able to connect directly with you? I mean, you could connect as far as, I mean, if you wanted to like schedule an appointment, something like that, you could reach out to my assistant, Kate. Her email is staff, at naturalendocrinesolutions.com. You can also attend the upcoming challenge if you, to get a little bit more, I guess you could say, contact with me. I'll be like answering questions during the challenge. That's what's on the screen here on the slides. But yeah, so there's also the school community. You might want to consider that, which let's see. So that's the school community too. So yeah, savemythyroid.com/heal Graves' disease. Okay, so our world. How long is it safe to be on methimazole? I've been on a low dose, 5 milligrams. Is it 5 milligrams or 0.5 mil? So you're on a low dose. 5 milligrams is a low dose every other day for 3 years. Now my endocrinologist seems to think that's okay. Yeah, I actually have a podcast episode on low dose methimazole, and studies show that as long as you're tolerating it, you could be on 5 milligrams for many, many years. Some people have been on it for like 15, 20 years. Now, it's not ideal. I mean, ideally, you want to address the cause of the problem, but yeah, being on 5 milligrams or less of that is fine. Even, I mean, 10 milligrams is still a low dose, but yeah, 0.5 milligrams. Yeah, so again, it's if you're tolerating it well, it does seem to be safe. And then yeah, he said a patient could yeah, he had a patient on it for 20 plus years. Yeah, I mean, let's put it this way: if it's a choice between radioactive iodine, thyroid surgery, or stay on low dose methimazole, I would always say stay on low dose methimazole, like save your thyroid. But the goal really should be to try to address the cause of the problem while being on the methimazole. And maybe you've tried doing that, but really you want to try to, yeah, address the cause so eventually you don't need to rely on the methimazole. Okay, and then also my numbers seem to be well, no nodules. I have Graves' hyper. Okay, good, 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 good. And then never talk to take it out. Yeah, no, that's, yeah. Again, I wish more doctors were like that. A lot of them just pressure their patients to get radioactive iodine thyroid surgery. All right. So next question is carbimazole dosages equal with methimazole? Usually it's similar. Yeah, in most cases, it's like PTU, propylthiouracil, is completely different. But yeah, in this situation usually is similar dose. They usually give similar dosage to when compared to methimazole. All right, Allworld, you are welcome. Okay, any other questions? So again, for those who trickled in late, for those with Graves, you might want to check out my Healing Graves Naturally School community. Um, it's a small community, and then again the challenge that I'll be having starting next week. Let's see. So Barbara, thank you. I'm on 2.5 milligrams, but still feel horrible. Yeah, I'm sorry about that. So yeah, definitely. I mean, again, you might want to, if you haven't done anything naturally, whether someone has or hasn't, but especially if someone hasn't, the high, like starting with diet, lifestyle, is a really good idea. So again, checking out my book and or the upcoming challenge would be a good idea, like a good place to get started. All right. If there are any other questions, definitely let me know. Not, that's okay as well. But yeah, I am here for you. Oh, okay. Let's see. We do have some more questions here. Okay, I will connect with the challenge. Wonderful. Okay, so Laura, bugly doses, please. I assume toxic multinodular goiter and hyperthyroidism. I mean, it depends on the person. Not everybody takes the same dose of bugleweed. So, like when I dealt with Graves, I took 5 milliliters, which is 1 teaspoon, twice per day of Medier bugleweed, which is a 1 to 2 extract ratio. So it really depends on what bugleweed you're taking, what your numbers look like. If your numbers are pretty high, your T3, T4, then again, I would recommend like 5 milliliters 2 to 3 times a day of a 1 to 2 extract bugleweed. And if it's not as bad, then someone might not need as high of a dose. Then usually I would recommend like maybe like 2.5 milliliters, once or twice a day if their numbers are mildly hyperthyroid. So it depends. And then Laura, yeah, I have. Okay, great. Yeah. So if anybody has my book, I would you could send. There'll be an email going out, but if someone wants access to the challenge, and there's actually instructions. There should be instructions if you visit this website here. Let me just make sure before I direct people to that. Yeah, I think on the website it kind of instructs, because yeah, like if someone has, my guess is there's going to be a lot of people who have my book or get my book to try to like to enroll in the challenge. So actually, you know what? Let me do this here. Okay, and I'll get to any other questions in just a minute, but okay, and that's for those, if you purchase my book, The Hyperthyroid Healing Diet, in any format, including the audio format, it is on Audible. Just forward a screenshot of the order number, email it to support@savemythyroid.com, or you can take a picture on your smartphone of holding the book and sending it to us, and then we'll go ahead and register you either way. Okay, let me go ahead and get to some of these other questions. Okay, and Laura, you are welcome. Okay, and thanks, Barbara. Yeah, I think you'll find the book to be valuable. It's pretty comprehensive. It's a yeah, and I mean, you could skip around. You don't have to read from front to cover, but there's definitely a lot of information. As Laura could tell you, Laura said she got the book, so Um, okay, so tell me foods that are prohibited in a hyperthyroid person. So again, I would say it's good. It's very time consuming to list all the foods that are prohibited. So again, I'm going to direct you to my book on Amazon or to attend the challenge. Again, the book, I actually have the book right here. My book, The Hyperthyroid Healing Diet, very comprehensive, pretty thick book. You could see. Yeah, what does it have? How many pages? I forgot how many pages it has. It has, yeah, including the index, like 423 something pages. So, but it also has like yes, no lists. When you get it, you like get access to yes, no lists to make it easy, like which foods to avoid, which foods you could eat. But yeah, that's why for that question, that's why I wrote the book. So it's not that expensive. I don't what is it like probably like $20 to get the book or $10 for maybe the Kindle version. All right, so John's question. So I'm on 5 milligrams of methimazole for Graves' hyperthyroidism. My numbers are all normal. I have heart blockages, no symptoms, but you're taking nattokinase. Okay. Let's see. Then also you mentioned I've been feeling strange after a few days. I switched to lumbrokinase and I have the same strange feeling off after a few days. Could these supplements be affected by my thyroid? They shouldn't. I'm actually familiar with both of those. I'm pretty familiar because I don't have any like I don't have any known cardiovascular issues, but I just take it kind of preventative. Yeah, so I'm actually well familiar with both of those, and I've not heard of any. I mean, I can't say it's those where I recommend most of my patients to take those, but I have not seen anything where those supplements being affected by thyroid or vice versa. So it's odd. If anything, I mean, when taking them on an empty stomach, they also like help with inflammation. So if anything, you figure it would be helpful for someone with Graves. But so I'm not sure. I don't know why you would feel strange uh, after that. Now, again, is there? I don't think there's any interactions with methimazole. I'm not 100% sure. Like I said, it's not like one of the more common supplements I have people take. There are others that are more of a priority, when it comes to that. I mean, you could always check with like a local pharmacist or online pharmacist, and they have like their database, and they could look and see if there are any interactions between methimazole or nanokinase, lumbrokinase. You might even be able to find that online, um, but yeah, so that's the only thing I could think of maybe, but with the Graves and the hyperthyroid, like the thyroid, the autoimmune component, yeah, I don't know of any interactions with that. Even with thimerosal, I'm thinking probably not. But if you want to play it safe, you could always double check with, like I said, with the pharmacist. Otherwise, I guess I would listen to your body, and maybe for now, maybe when you're at the point where you're off the methimazole, you could try again. But if you're not feeling right and you're sure it's related to that, which it sounds like it is, just because maybe those were the only things you introduced and then started not feeling well. Okay, so Cambert says, would someone who specializes in Hashimoto's also be able to to help treat Graves naturally? Just hard to find someone like you in the UK. I'm not saying they can't, and I do work remotely too. I actually probably the second most people in the United States I work with are those in the United Kingdom. We have a lab like Genova Diagnostics UK. We have an account with. So I mean, you could always reach out to my assistant Kate. But we work with a lot of people in the UK. One of these days I have to visit the UK. That's definitely high on my list just because of the people we see more people in the UK than we do like Canada, for example. But to answer your question, I'm not saying they can't, but it's not. I mean, it's nice to have someone. especially, I mean, if you're taking the medication and not doing things like bugleweed, motherwort, lemon balm, L-carnitine, then in that case it might be okay. But but again, it's yeah, that if you're not taking the medication, I definitely would say work with someone with Graves, because most people with Hashimoto's, most people in general, along with, I mean, even those who say that they have experience with Graves, it's surprising how many people are not familiar with the herbs and the natural approach. And I mean, there is some overlap of triggers without question between Graves and Hashimoto's. There are some differences, but um, I mean, if you, I'll say this. I mean, if you absolutely can't find someone and you want to work with someone like face to face, it's better than not working with anybody at all. But yeah, I mean, you could always ask them to get my books too. I don't know if they would take the time to read it though, if they're focusing on Hashimoto's. Um, but yeah, it's always best to work with. Like if I was going to work with someone, the opposite. If I was working with someone who had Hashimoto's, could I work with someone like me, and get results? Yeah. I mean, again, I wrote a book on Hashimoto's, so I do have experience with both, like working with both. But uh, the problem is the reason I've experience with Graves is because I personally dealt with it. Most people with Hashimoto's don't have that experience with Graves patients. Um, just there's a lot more people with Hashimoto's, so usually that's why a lot of people focus more on Hashimoto's. So like I said, better to work with someone like that than nobody at all. But yeah, and like I said, if you're feel free to reach out, my assistant Kate, if you want more information about working with me, because like I said, I do work remotely with people from all over the world. So um, okay, this book is great. I got it on Kindle. So good. Thank you. Thanks, Laura. Okay, so I can't buy the book because you're in Ethiopia and having a credit card to buy the book. What I would say then, go to my podcast, savemythyroid.com, and there's free information talking about like diet, so yeah, that's what I would recommend. Or again, if being in Ethiopia, I don't think should prevent you from buying it. If you don't have a credit card, maybe like you could ask a friend or someone like that. But again, there's some episodes on the podcast where I talk about the foods. Um, so I would do that. It's obviously not as comprehensive, but I can't spend like 30 minutes here like going over all the foods like you could eat and can eat here. So like I would say go to my podcast and check that out. Okay. Okay, that's interesting. Yeah, I guess instead of the nattokinase or lumbrokinase. Okay, interesting. Okay, we got looks like Andrea. Andrea from Romania, Eastern Europe. Is it Popescu? I don't know if I pronounced that right. Okay, not sure what your question is. Please tell me, how do I know the state of my thyroid without blood work? Yeah, you really can't know the state of the thyroid for sure without blood work. You really do need a thyroid panel. I mean, you could get an idea, like if someone uh, has hyperthyroidism with some of the symptoms like tachycardia, increased resting heart rate, palpitations, hypothyroidism like coldness. I mean, some people use like basal body temperature, but really the blood testing is the best. Yeah, I mean, and then it says I'll have only hair mineral analysis tests and gut advanced microbiome tests, food intolerance tests, which is great. I love those tests, especially I do hair mineral analysis testing. Um, and gut microbiome testing. I'm not a huge fan of food sensitivity testing, but either way, yeah, like I don't rely on those to tell me if someone has a thyroid or autoimmune thyroid condition. Haven't done my blood work in a while. Yeah, I would avoid. I'm not saying. I'm not sure if you're saying you would avoid the blood work. I'm healthy, just curious. I'm 42. Yeah, like I said, the only way really to know for sure is by blood work. Doing a simple blood test, looking at TSH, free T4, free T3, as far as determining if someone has hyperthyroidism or hypothyroidism, or if you have a good thyroid, healthy thyroid. So it sounds like maybe you don't have that issue, and a hyper or hypo, but okay, our world. Okay, yeah, markers for both. All right. Anything else? Any other questions? We've had oh, how can someone work with you on Zoom? Um yeah, so I would say either reach out to my assist so reach out to Kate. You could also, another option here, I'll include this, and um, so there's also this, work with dreric.com. So because Kate is off until Monday, so you could contact my assistant Kate. Her email is staff, staff, at naturalendocrinesolutions.com. Or again, you could visit workwithdreric.com in the meantime for more information. And this also is an option to, I just created this little banner. So Kate, staff at naturalendocrinesolutions.com. So that's her email address if you want to speak with someone. Okay, let me see what other comments. Let me actually stop. Okay, yep, you are welcome. Can I take 1 drop of iodine per day without knowing the state, like knowing, the health of your thyroid? It's a good question. I would be cautious, and I'm not against iodine. I actually had a good experience with iodine in the past, but I mean, 1 drop, if it's like Lugol solution, it's still a decent amount of iodine. So when we're talking about micrograms of iodine, it's not as big of a deal, especially if it's like just a couple of hundred micrograms. But when we're talking about milligrams of iodine, it can cause a problem in some people. So so yeah, again, so I would be a little bit cautious. Yeah, so you said Lugol's. Yeah, so Lugol's, like I said, that's my opinion. I have a lot of experience with iodine, so I'm not against iodine. I'm a little bit more for iodine because, again, iodine's important, but I'm also very cautious with iodine because I've seen some negative things with iodine, and I know all about, like, like some will say, well, if it's negative because people weren't, like, you weren't taking proper precautions, but yeah, anyway. So I would, like I said, I would be cautious. Okay, greetings from Germany. Age 67, in September 2025, I was diagnosed with Graves' disease. Started with 20 milligrams, already down to 5 milligrams every second day. Awesome. So that's wonderful that you're now on a lower dose. Yeah, 5 milligrams every other day. I mean, and hopefully you'll get to the point where you don't need it soon. Obviously, I would also make sure, in addition to the thyroid number, like TSH, free T3, free T4, also make sure they're looking at your antibodies, because that's a big mistake that many endocrinologists make, is that they'll put someone on the medication and then the numbers will improve, but they won't monitor the antibodies. And as long as you have positive Graves antibodies, there's a chance you'll become hyper. So if someone's off the meds and they still have positive TSI, thyroid stimulating immunoglobulins, and or TSH receptor antibodies, then again, there's a good chance it will become hyper again if they get off the antithyroid medication. So yeah, just make sure, because not all endocrinologists monitor the antibodies most of the time. A lot of the time, they're just looking at the thyroid numbers, and that's not really true remission if someone's thyroid numbers are looking great, but the antibodies are still high. That being said, that's great. That's great that you got the dose down from, like 20 milligrams a day to 5 milligrams every other day in just yeah, what is that? 4 months, 3 to 4 months. Yeah, I guess 4 months, September. So okay, please tell me, are there at home tests for thyroid or urine tests for iodine? I don't think anymore. There used to be some labs that did like blood spot tests at home for thyroid, but I think they showed that it wasn't really accurate. So urine test for iodine. I don't know where you're located. You're in a different country. I don't know internationally. I know in the United States there's a company, Hakala, H as in Harry, Hakala, Hakala Labs, where they offer urinary testing for iodine. So they have either like a spot test or what's called an iodine loading test. So they probably have other companies like worldwide, not like associated necessarily with Hakala Labs, but other companies that do something similar. But that I'm not familiar with, like in other countries. But yeah, that would be the one I'm familiar with. All right. Again, for those who trickled in late, just as I have on the slides here. So next Saturday, I'm offering a 5-day hyperthyroid healing challenge, and with daily lessons, live daily calls, engagements, only $17 or free if you have my book, The Hyperthyroid Healing Diet. Or if you don't have it, you could still purchase it and get access to it. And and if you're interested, visit savemythyroid.com/challenge 2026. And then yeah, put in the chat if you already have my book, you could just send a screenshot, or let me do this, a screenshot, or you could take a photo of you holding my book and send it. Let me just create um I was trying to create another banner like I just did. Maybe I'm at my banner limit. But anyway, support at savemythyroid.com is where you could email that to. Okay. Any other questions? I'm actually deleting. I have a bunch of banners that I won't be needing. I have one from 2023. Checking my daily temperature. Can I? Yeah, I mean, you could find, it's just not a perfect test like checking daily, like doing basal body temperature. So you could like do some searching, like for how to check basal body temperature, and I'm sure there are like some YouTube videos on that, and you could do that. It's not perfect for that, but it's a little bit better for hypothyroidism, like low thyroid. If you have a lower basal body temperature, then that could indicate that you have low thyroid. Oh, okay. I'm interested in my thyroid because my hair falls a little. Why don't we? I don't understand why you don't want to just get a blood test, though. I mean, it's not that difficult. I mean, unless if there's something preventing you from going to a lab. But 'cause it sounds like you don't want to go to a lab to get blood testing done. I mean, you could, maybe another option is have a phlebotomist, like pay for a phlebotomist to come to you, and do the blood draw. Okay, so Katie says my doctor checks antibodies every month. Okay, wonderful. I'm afraid I could get anemia from a I mean, do you already have anemia? I mean, if you even if you have anemia, I mean, if you just do a thyroid panel by itself, it's just, I mean, it's just like one vial of blood. It should be. Um, so, yeah, I mean, if you already have anemia, I guess I could understand, but everything's risk versus benefits. So if you have like really severe anemia, then again, I guess I could understand. If you're afraid that it will cause anemia, I wouldn't be concerned about that. Like if you have normal hemoglobin, hematocrit, red blood cell count, yeah, I definitely wouldn't be concerned. Even if it's on the lower side, I wouldn't be too concerned because again, it's not like you're doing a lot of, not like for a thyroid panel, they're doing taking a lot of blood, doing a lot of vials. So our world, my labs are every 3 months, or if I feel off, yeah. I mean, if someone's taking antithyroid medication or bugleweed, like if they're working on restoring their health, I personally like seeing a thyroid panel every couple of months, like every 2 months. I mean, 3 months would be a little bit on the longer side. Do eye floaters have to do with thyroid? Usually not. A lot of people have eye floaters. I don't know any relationship with thyroid, with eye floaters. So, but I know for sure that there are like, again, is there a possibility that there could be a relationship? I guess there could be. I don't know of a relationship, but I know there definitely are other relationship. Like there are other. Sometimes I get eye floaters. So, and again, my thyroid's been fine for years, but yeah. So the eye floaters, I wouldn't say. The hair loss could be. Hair loss could be thyroid related. Could be nutrient deficiencies. Graying hair is usually oxidative stress, like increased oxidative stress, which could be due to like Graves or Hashimoto's, but usually it's other causes, and not necessarily thyroid. I'm not sure. Usually hyper or hypo. Okay, you think it could be linked to TED, so thyroid eye disease. Yeah, I mean, pretty common with Graves. A lot of people have thyroid eye disease. Most of the time, it's mild, but sometimes it could be more severe. Okay, so thyroid, yes. How can I avoid a reoccurrence? I would look. You're on YouTube. You're asking us on YouTube. Under my channel, there's an episode, how I maintain a state of wellness. So I would look for that episode on YouTube. Just go under my channel, like the videos, and there's a little search thing, and just type in wellness, and you should find it. How to maintain a state of wellness, and I put that together, what I've done over the years, and yeah. So that's what I would do. I mean, you don't need to be perfect, I'll say that, but you do want to eat whole, healthy foods, try to minimize stress, block out time for stress management, get sufficient sleep. Again, perfection isn't necessary, but overall, you want to do a pretty good job. All right, this has been really good so far. So good amount of questions. Again, the challenge that I'll be having, um, there'll be plenty of time for Q&A at the challenge as well. Like I said, if you already have a copy of my book, it's free to enter. Just send an email to support@savemythyroid.com with look up the order number when you purchased it. If you got it on Amazon, you should still be able to find the order number. Or if you have the physical copy of the book, you could just take a picture have someone take a picture of you holding your book like that, or I guess you could try to do a selfie and send it. But yeah, and if not, if you don't have a copy, you could get a copy, or you could just pay the $17. Even if you didn't, even if I charge $17 without giving it away for free for those who have a copy with the book, I think you'd find it worth it. But just giving that as an extra incentive for those who have the book, or again for those who don't, to try to encourage you to get the book, because I think definitely is worth whatever it costs, like $20 or sensitive for gluten. Should I avoid gluten? A long period. I mean, while someone's healing, I do recommend avoiding gluten. While someone's restoring their health, I mean, it's great to also do it afterwards, but at the very least, while restoring your health, yeah, I would say to avoid gluten. Okay, Hannah, you are welcome. Thank you for tuning in. And Camber, thank you, Dr. Eric. You are fabulous, fabulous. Thank you. I appreciate those kind words. Hopefully, we'll see you in the challenge next week. And yeah, the times, I didn't put the times here. I'll be rotating times to accommodate those in different time zones. Everything will be recorded for those who can't attend live. So yeah, was important to mention that as well. Okay, thank you. You will be in the challenge. Wonderful. Look forward to seeing you, Andrea, and hopefully some others as well. So again, that's the link, savemythyroid.com/challenge 2026. All right. Well, I think I will call it a day. We did pretty good here. Went almost an hour. A good amount of questions. So yeah, thank you so much for tuning in, everyone. Hope everybody has a great rest of your day. Hope you have a great weekend ahead. Again, Happy New Year, everyone. And look forward to seeing you in a future live event like this. But again, there's going to be 5 days of a live event like this, presenting content and then answering questions. And then there's also a VIP upgrade where there's even more support with that as well. So, but anyway, hope everybody again has a great Friday, great weekend, and I'll see you soon. Take care, everyone. Okay, thank you. Thanks, our world. Happy New Year to you and everyone else as well. Okay, bye-bye.